My name's Tori, and I am a mom. This is Zachary, my 10-year-old son, and I'm married. We have several dogs. I am a business owner. I own a real estate company and property management company, and we live in Orlando, Florida. Zachary was playing soccer and basketball and karate. Then in July of 2010, we got a call. He was sleeping over at a friend's house, and the mom asked us if he had any allergies because he started vomiting. And he didn't have any allergies, and I went and I picked him up and I brought him home, and at 1 o'clock in the afternoon, he was perfectly fine, right? He wasn't sick at all anymore. And he was fine for the next few days, and then about a week later, he was vomiting again, and it started becoming progressively worse. So we took him to the pediatrician, and the pediatrician said that he thought he had the flu. So at that point in time, we thought perhaps that was the issue. However, over a couple of months, he started getting worse, and he started vomiting every other day. So we went back to the pediatrician because we were concerned, obviously, as a parent. And they sent us to the head of a gastroenterologist department here locally in Orlando, who initially the doctor told us that Zachary had impacted bowels. They had done an x-ray of his colon and said that he was backed up, and about a week later he still wasn't evacuating, so we got concerned. And they told us that it was getting worse. So we proceeded to get an appointment with an ENT, and Zachary got to endure a CAT scan. You thought that was kind of cool, right? Going in that machine?
You just lay there. Nothing happened.
You just lay there. So after his CAT scan got done, we found out he had nothing wrong with his adenoids and nothing wrong with his sinuses and nothing wrong with his tonsils. Therefore, there was no need for him to take the sinus medication. We proceeded from there to an allergist because it was suggested we go to an allergist. And we went to an allergist who said he didn't have any allergies. So he progressively was getting worse. He couldn't get off the couch. Walking to the front door, his heart would race. And obviously at this point, we're about 5 months into this and very scared. From there, we went back to the pediatrician, and they told us that they thought he had anxiety and depression and he didn't want to go back to school. And that's what was causing him to throw up. My sister called me one day and said, has he been tested for parasites and bacteria, because we had been traveling on cruises. And we went back and tested him, and within 2 days found out that he had been diagnosed with diatentomyba fragilis, which is a parasite that lives in the intestinal tract. And we proceeded to go see another gastroenterologist, an infectious disease doctor, who basically spent 3 hours reading medical books with us and prescribed the medication for him that didn't work. However, he did get better for a short period of time, and then he continued to be sick, and we retested, and he still had this parasite. We then went to another gastrointestinal infectious disease physician who was the most honest with us, was he not? And he said he had no idea, that's right. He said, I'm not sure how to treat this. We don't see this parasite very often, so I don't really know what to do, but I'm going to prescribe this medication and you can try it. Needless to say, we're 7 months into this with him very ill and vomiting every other day. And I spoke with a sister of mine, Terry, who suggested I speak with a gentleman by the name of Renzai out in Sedona, Arizona, who gave us a homeopathic remedy, which we gave to Zachary, and that actually did kill the parasite. So he did not have diatentomyba anymore. And Zachary took about 2 years for this whole process. So, you know, after about 2 years, he was healthier, still not able to play sports, still not able to go back and interact the way that he was previously. But we had a good year, right? And then November of 2013, he was sick again. And this time, he has blastocystis hominis. So the doctor, when Zachary told me he was sick again, he told me for 2 months, and he started getting worse. He's not vomiting this time, but he's very nauseous and doesn't feel good. So we went to the doctor, and we told him that we needed to test for the parasite. And they went to write 1 prescription, and I said, no, we needed 6. because we've been going through this for 3 years now, and we knew one test result. And when you look at the lab test results, they very specifically state on there that one test is inconclusive and you can't just rely on one test. But the doctors don't tell you that. So when you go back and you get all the records and you actually look at the lab reports, you can find out at this point that one test is not adequate and it doesn't work. So when we went to the doctor and we told him that we thought that he had the parasite again, what did the girl do?
She brought one test.
And she tried to write your prescription? Mm-hmm. What did you say?
I didn't say anything. You freaked out at her.
I didn't freak out at her.
Yes, you did.
I asked her why she was giving you medicine when she didn't know what was wrong with you. And she said, well, you said you think he has a parasite, so I'm going to write a prescription. Well, I did freak out a little bit, I will admit that. Because there's no reason to give him a prescription for another medication that's going to damage his immune system when we don't know what's wrong with him. So in any event, we did a parasite test, it came back negative. A week later, we did a test, it came back negative. A few days later, we did our third test, and I got busy. I'm a business owner. I didn't have time to get the test results to the lab. I was actually embarrassed and afraid to take the test results to the lab because at this point I just was frustrated, and I took them anyway. And within 24 hours we got a call that his test results came back positive. So I later did the fourth test and I held on to it for 2 weeks intentionally because I did some research and found that this parasite dies when exposed to oxygen. And that test result came back positive in less than 24 hours. The lab was calling us. I actually thought they had made a mistake by calling that quickly. His pediatrician basically said, you know, why does he keep getting these? I thought for a minute, why are you asking me this? You're supposed to be the doctor. But at the end of the day, they basically said, we don't know what to do. And I called medical professionals literally across the country. My husband's in the medical industry. He reached out to people that he knew. And, you know, I literally got an email from a doctor that was sent to my husband that said, we don't know how to treat this parasite. We medicate, we pray the symptoms go away, and we don't test for it again because A, the labs are not proficient enough to get accurate test results, and B, we don't know how to get rid of it. So that's been our journey, and Zachary's not been able to play sports for 4 years now. Okay. So how do you feel? How's your energy level? Do you want to go out and play?
Yeah.
Can you go out and play?
Sometimes.
Sometimes. And when you go to PE and you run around, how do you feel the next day?
Sick.
Sick. And when you wake up in the mornings, how do you feel?
Nauseous.
Nauseous.
Some days worse than others.
Right. And you can't get out of bed. So this is what he's been experiencing for 3 out of 4 years. It's a little challenging to get your child back into a medical office when they've experienced what Zachary's experienced, and it's kind of frustrating to try to get any kind of assistance because now he doesn't trust anybody in the medical industry. We pray that we're able to change that here pretty quick, right? So we're looking forward to getting healthy and finding the solutions, and pray that happens.
Hey, I'm Russ with the Institute of Nutritional Medicine and Cardiovascular Research, and what we do at our company, we design custom treatment protocols for men, women, and children. Okay folks, what we're going to do today is we're going to talk about Zach, and we're also going to talk about his mom, Tori, because actually we have 2 patients here. Anytime you have a child that's sick and the mom's trying to get answers, the mom ends up compromising her metabolism too, and she ends up getting sick, and I've seen this 1,000 times. So what we're going to do with Zach is, thank goodness Tori kept meticulous records because we got about 4 years of data to look at. And what we're going to do is we're going to drill down on some of that data to find out what the doctors came up with, what they missed, and then we're going to plug in a treatment protocol. And let me tell you something we found out right away. Some of the medication that was prescribed for Zach slows down his digestion, and it allows food to pass into his intestinal tract undigested. So in order to get Zach's body to resonate, we have to balance out his intestinal tract. Now, in reality, every day Zach needs about 21 minerals, 13 vitamins, 8 amino acids, and 2 essential fats, and a little sunlight to keep his energy levels up. If Zach isn't pulling nutrients out of food, which I know he's not doing right now, his body's going to mine it from his own tissue and make him tired. So not only do we have to look at Zach's intestinal tract to get his body to resonate, but we got to look at other hormonal areas that may have been compromised while Zach's metabolism was fighting this parasite. So while everybody was looking at the parasite, some doctors took the eye off the ball of other parts of Zach's metabolism that we're going to measure and design a treatment protocol for Zach. Okay, like I've said, I was blessed to work with hundreds of mothers that are passionate about helping their children. And what happens is they get maligned, they get told they're crazy. The mothers that live with their child every day see signs and symptoms that doctors don't. So what happens is the moms get taken on this journey over 2 to 4 years of allergists, internal medicine doctors, and all the time hoping that they're going to get answers for their son or their daughter, when in reality the moms end up getting sick. So how do we get the moms well? And we're also, working on designing a treatment protocol for Tori that's going to look at her HPA axis. Basically, we're going to look at her brain, her adrenal glands, and her thyroid, and all the stress that she's under. We're going to ramp that system up so her shield goes back up so she can continue this fight to help her son get well.